Many of you know about Advocacy Talks, which is an initiative that I was working on when I was at the National Post newspaper. And the goal then was to align patient advocates across Canada, policymakers as well, industry if they were interested, and to sort of talk about, like, really move beyond surveys and coffees and conferences, and really talk about the barriers and challenges that we're facing as advocates and people who are in this world, and then also figure out like how we're going to move forward and just do something about it, and at the same time improving the healthcare. So we did advocacy talks. We had two very meaningful conversations that lasted almost 4 hours each, which was amazing. What did we hear? What did we hear from you guys? We heard that, people that work in lived experience and patient engagement are not okay. We learned that we're looking for more information on how the healthcare system works and how it doesn't work. We're looking for peer support, a way to support this very hard work that we do, which doesn't exist right now. How can we get the patient voice into industry, like clinical trials, for example, and also into pharma? And just basically into business models. And so we had this great talk and everyone was pumped up and we were going to influence the election and it was so awesome and we were pissing people off, which was great. And then I got laid off because, well, look at that. Patient engagement doesn't make money. Oh, that's so bad. So anyways, here we are. We're doing it again. And so underneath Zal's great name, Involve Canada, we are doing it again. So today, what we're going to talk about is a little bit more about, kind of what we see, the vision that we've kind of come up with based on what you have told us. Lori's going to talk a bit about her presentation on the lack of patient engagement in pharma, which some of you have seen already. It's amazing. And then Zal's going to present the nuts and bolts of this organization.